Namaste, I am Dr. Agnivesh Tikku and I am a spine surgeon at Apollo Hospitals, Navi Mumbai. Today we are going to speak to you regarding the common ailments which affect the back and neck or the common causes of back pain and neck pain. Now, back pain and neck pain both are very common problems which we encounter, and a lot of this is because of our bad posture, because of our sleeping habits, and because of the lifestyle which we live today. But regardless of that, we have to be careful with certain signs in the age groups, especially in children and elderly population regarding back pain. Children usually do not complain of back pain, and if they complain of back pain, unless they have had an athletic injury or something, it should be taken seriously and you should consult a doctor. Similarly, in the elderly age group, above 60, senior citizens, who complain of back pain first time in their life, which means that it's a new symptom rather than an old symptom, we also should not neglect this and see a doctor immediately. Now, there are certain red flags which we need to be aware about, and if they are associated with back pain, you should not delay any treatment or you should not delay consulting a doctor. These are if you have a pain which is associated with fever, if you have a pain which is associated with numbness, tingling in the legs, or any loss of bowel bladder control, or difficulty in passing urine or controlling motion. If you have back pain which is more in the night and it disturbs your sleep, these are the common red flags we should be aware about. If you're having back pain which is also associated with weight loss, then again it should not be neglected. If you don't have these red flags, then probably the chances are that you have a back pain because of your postural problem or vitamin D deficiency or because of lack of exercises and proper care. So these are the common reasons why we have back pain. In the younger age group, the postural, especially because of work from home, has become a big problem because we work from home for a long time and probably we do not have good desks, good chairs to sit, and we work in a bad posture, in a bad environment, and this causes a lot of problems, back pain, neck pain, and many others. Now, another common problem in younger age group is having a slip disc. A slip disc is basically a herniation or displacement of nucleus pulposus, which is actually the gelatinous portion of the disc, through annulus fibrosus, which is the outer tough layer of the skin. And once it impinges onto the nerves, it causes back pain and it may lead to something we call as sciatica, which means a pain radiating from back into the legs. Another important reason, which as the age progresses, is spondylosis. Spondylosis is wear and tear related problem. Anything that moves will wear off. So if you have movement in your spine, in your lower back, in your neck, it is going to wear off, and this causes some pain. When this wear and tear starts pressing onto the nerves because of the increase in the tissues around the joint, increase in osteophytes, then they lead to nerve related symptoms, which may be pain going into the arms or in the legs, depending upon the location, or loss of control over the hands and legs as the problem proceeds further and further. So, before this happens, if you correct your posture properly, if you take care of your spine, chances are that you will live it enough that it doesn't trouble you a lot. And last and foremost important reason which commonly we encounter is vitamin D deficiency. We tend to live a lot of life indoors. Vitamin D is formed in the body only by sunlight, and if we are not exposed to sunlight, the chances are that we become deficient in vitamin D. And that sunlight has to be sunlight at a time when your shadow is not longer than your body. Your 40% of the body area is exposed to sunlight for at least 15-20 minutes, and then an adequate vitamin is formed. But if we are not having that level of exposure, then your chances of vitamin D being normal are very less, and you should check it regularly, and we may need to take a maintenance dose if we are persistently remaining deficient in vitamin D. Regardless of all this, most of the back problems can be treated by proper care, proper posture, and doing regular exercises under the supervision of a doctor or a physiotherapist, and living a healthy lifestyle. Thank you very much.